Hi, it's Dr. Janowski for Sonata Aesthetics. Today we're talking about Bellafill. Bellafill is actually becoming quite an old product now. It's probably been around 10 years or maybe more. It used to be called Artifill. And Bellafill is a special product. It's a filler, but it works differently from just about any other filler. It's a collagen stimulator, and it contains these tiny little beads called PMMA. These little beads will induce collagen response and have your skin grow new collagen wherever we put it. So it's a really nice product, and the only FDA approved product for acne scars. So we use it very commonly for acne scars. Remember, there are different types of acne scars, and we're talking about the kind that we call atrophic acne scars, which are sloping in nature. They slope this way as opposed to ice pick scars which are more like holes, and boxcar scars, which are more shaped like a box. So these are sloping acne scars. And so that's the kind of scar that this is going to work well for. And it may take several treatments, but we can build up collagen in those scars to reduce the pit of the acne scar. And we've been using for many years with great success. So I'll demonstrate how we use Bellafill in a moment. Bellafill is the longest lasting filler on the market. It's been studied out to 5 years, so that's a really nice advantage to this product. So if we can use it and get it to work, it will last a long time, particularly in scars and patients who are not developing new scars. So when I inject Bellafill, I use a 29 gauge needle. I do put 0.1 saline with a little small amount of epinephrine and lidocaine just to thin it out a little bit. So 0.1 per syringe. I mix it together because it comes fairly hard to push. I'm using a 29 gauge needle, and I like to use a directional light to help highlight the scar area. And we can see there are some appropriate scars which are sloping in nature and would be considered atrophic scars. So I'm going to take my Bellafill product, and we're just going to do little pokes. I will go into the scar and inject as I come out. And you can get pretty close to the surface here. And then I'll just massage it a little bit like this. Good. And, you know, maybe 0.05 to 0.1 injection per scar. And we're just going to look for those little depression areas, and we're going to inject into each one individually. Again, I tend to inject as we come out. If you put the needle into the scar, it's hard to push the product out, so I go through the scar and come back out through the scar as I inject here. And you can go 90 degrees, you can go 45 degrees. It doesn't matter too much. Here I'm going mostly about 45 degrees and injecting as I get through the dermis like this. Good, you doing okay?
Mm-hmm.
Yeah, so it's not difficult. We had put some numbing cream on originally, and that's typically all you need. And it's okay to see a little bumpiness. This will all settle. I've never had Bellafill cause a nodule at the skin from using it in this way. And today we're just going to do 1 syringe per side, so I'm just going after as many as I can here on this side. Good, and that's 1/2.
Okay.
So again, we flip to the other side and we see this area here, which has a mixture of different types. For example, this is more like your boxcar type, less likely to respond. But we see the atrophic scars here, and we're gonna just inject as we come out. It's okay to see that little bump, it's fine. Remember that Bellafill also has some cow collagen in it. The cow collagen gives a nice immediate effect, but that is not the long-lasting effect of Bellafill. That's just kind of a temporary effect to give some instant feedback and instant improvement, but that cow collagen will dissipate in about 2 months. And then it's the other product, the PMMA, that actually does the work. So you always tell your patients to expect It's going to look good initially, it may go down and then come back up again as collagen forms. The company does recommend skin testing for cow allergy, although in practice it's rarely needed because it's very unlikely to be the case. And even if you test negative, you still could have an allergic reaction, but I think I've only seen maybe one, and it's simply treated with steroids. So that's one on each side there. And you can see some instant smoothing, but the real effect comes later. You have to be patient with it. So that's Bellafill for acne scars, a wonderful treatment in addition to all the other treatments that we have for acne scars. But again, you have to pick the scar carefully, the patient carefully for the right type of scar, and typically you'll need several treatments.